Huh?
You haven't seen this CBD swatch book?
No, girl. It was in the.
In the store.
Yeah. Is it in? Is it in dispense?
Itch mites.
Hold on.
Here you go. Don't worry about it.
Psoriasis is silvery scales.
Kirby, I'll come out this way. He's back. I'll look.
Okay. Thanks for the heads up. Which one you stop on?
Oh, okay. I was looking at the wrong way. I was like, what am I looking at? Okay. Okay, that's two different things. I'm gonna say, oh no. Okay.
Good. All right. So ringworm is the medical term for ringworm is tinea. It's red circular patches of blisters caused by a vegetable parasite.
It's
Ringworm of the scalp is Tinea capitis. It is enlarged open hair follicles that are surrounded by clusters of red spots. Hair is likely to break. Black spots may be visible. Honeycomb ringworm is called Tinea favosa or just favus.
I gotta see what Miss what is her name? The lady I was just talking about, I forgot her name.
Miss Mandy. Miss Clarice.
Yeah, that's her name. I can't forget her name. She called me earlier. I have to go see what she wanted later.
Oh, she called you?
And about something I was walking through there, thinking about something I wasn't paying attention.
Okay. So it's dry yellow encrusted areas on the scalp called scatula. It may have an odor. Its shiny pink or white scars may result. Itch mite, or also known as scabies. It's red and watery vesicles or pus-filled areas caused by animal parasite burrowing under the skin. Head lice, also known as pediculosis capitis, is an infestation of head lice on the scalp, causing itching and eventually infection.
Wait, I forgot one.
What'd you forget?
Greasy and white. Oh no, I did that one. Okay,
Yeah, you
sorry.
got that one. That's okay. So hair loss. Lanugo is fine, silky hair covering the body before birth. Vellus is short, fine, non-pigmented hair that replaces lanugo hair. Terminal is long, thick, pigmented hair such as scalp and eyebrow hair. Your average daily hair loss is 40 to 100 strands a day.
No, I just keep losing hair today. And then my head is scalp treatment.
So, androgenetic hair loss. Alopecia is excessive hair loss caused by fungal or bacterial infection or inflammatory disease of the scalp. So androgenetic alopecia is a combination of hereditary hormones and age causes progressive shrinking or miniaturization of certain scalp follicles. Its most common form, it's known as male pattern baldness or thinning of hair in females. How to recognize androgenetic alopecia? You want to analyze the hair loss for male clients. Ask if size of bald spot has progressively increased. Ask if hairline has been progressively receding. It is important to evaluate patterns separately from density. Recognizing androgenetic alopecia. To analyze hair loss for female clients, hold an index card near the scalp to help see the miniaturization of hair. Check width of part line. Review the size of ponytail over the years. Inquire about about amount of hair left in brush or drain after shampooing. The degree of hair loss can be elevated. I can't read today, Brianna. Can be evaluated by rating pattern and density. Pattern refers to shape and location of area. Density refers to how much hair is covering the scalp in the area of hair loss. Postpartum alopecia is a temporary hair loss after childbirth.
Mm-hmm. I had to go. I was pregnant. I had to just didn't know what to do.
Yeah.
My sister giving her baby up for adoption.
Really?
Mm. She wants to do an abortion, but I told her if she do an abortion, I'm gonna punch her in the face. Cause that baby did not ask to be in, and now she wanna go kill her baby. So I said, if you're gonna do it, just best to get the baby before adoption. And then the baby be with some other baby.
Mm-hmm. Alopecia areata is the sudden loss of hair in irregular patches.
Oh wait, it's right. That's what that thing was. Oh, okay. I didn't know what that was. Okay. Alopecia. Okay.
Telogen effluvium is premature shedding of hair. And then you have traction or traumatic alopecia. It's hair loss from pulling or twisting. Which one's you missing?
2.
Let's see.
Oh,
You got them all?
I'll just this one.
Which one? Are those?
Somewhere down I don't know.
Let's see.
Alopecia areata.
Arita?
Alopecia areata. Yeah, Rita. Aretha, something like that. Big words.
No, they're not on here.
Well, I'll Google it.
Not this one, right?
If not, I don't get it, I'll Google it.
Okay.
Just go Google it and let them Google it.
So, treatment of androgenetic alopecia is FDA approved products.
F. Oops.
Products that provide environments for hair regrowth. Surgical options.
Mm-mm.
Wigs, toupees, hair additions, and hair weaving. And then cosmetic hair thickeners. Oh, so then 7.3. Wow. Is it that long? Was it? Oh no, 7.3 is really short. So we can go through that one real quick before break.
Chapter 7 is huge.
Yeah, chapter 7 is a little bit
Okay, we're going to pause you.
more.
Do some hair.
And then, yep. We'll go on break after we finish 7.3, and then we'll come back and do some scalp treatments.
My stomach was getting me. Yes, if she. You can't hook up pro, so it'll be better.
Mm-hmm. So, the purpose of shampooing, or the safety and comfort and protection of the clients are all part of the salon professional responsibilities. The purpose of shampooing is to cleanse the scalp and hair by removing dirt, oils, and product buildup. Improper cleansing can lead to accumulation of oil and dirt and cause scalp disorders. Massage is a scientific method of manipulating the body by rubbing, pinching, tapping, kneading, or stroking with the hands, fingers, or instruments. Draping, performed prior to the hair care service to protect client's skin and clothing. Ask client to remove jewelry prior to draping and store in a safe place. Make sure neck of cape does not come in direct contact with client's skin. Use neck strip or towel. Towel and plastic capes are used for shampooing, sculpting, designing, and chemical services. Neck strip replaces towel following shampoo prior to sculpting services. Cloth cape is lighter weight, more comfortable, used during services on dry hair.
We got back shampoo and conditioner.
Huh? Oh, you want? Oh, yeah. The shampoo service is performed prior to most services except certain hair color or chemical straightening services. Soft water is rainwater
Wait, it
or
said perform before most what? It says perform before most and then nothing after that.
most services.
Uh-uh.
Soft water is rainwater or chemically treated water, generally preferred for shampooing. Hard water contains minerals and does not allow shampoo to lather freely. Remember to monitor temperature of water before applying to client's scalp. Always wipe any water to prevent accidents. Brushing and combing. You want to remove, it removes tangles, stimulates blood circulation, removes dust, dirt, and products. Avoid brushing prior to chemical service or if any cuts or abrasions are evident. After shampoo, tangles should be removed in a specific methodical manner. You want to start at the ends and work your way up. Does that make sense? I'm not gonna go through all that.
Okay, come on, I got
We
it.
know that. Scalp massage. Manipulations performed. Oh my God, what is that? Jeez. Manipulations performed on the scalp to relax muscles and stimulate blood circulation. Establish a soothing or stimulating rhythm. Maintain contact with clients throughout manipulations. Perform manipulations with firm, controlled movements and keep fingernails at a moderate length to avoid scratching the scalp.
I'll get my fingernails done. I'll just paint on actual colors. I was gonna get them done longer, but not stand out way. And I'll just paint them like regular polish.
Yeah,
And I'll just paint them just regular Christmas colors.
there you go. So, effleurage. Just put light gliding strokes.
Oh yeah, we don't have to do this part. I actually have the paper to tell me what it is at home.
You don't have this part?
No, I have the paper that tells me everything this is.
Oh, okay, cool.
And I also have a flashcard on it. Yeah, I did it at another school and I wrote it down.
Oh, nice.
So I'll do this one and I have the paper at home.
You want me to just go through it though?
Yeah, you can still go through. Yeah, I was.
So effleurage is light gliding strokes or circular motions made with palms of hands or pads of fingertips, relaxing and soothing effect. Petrissage is a light or heavy kneading and rolling of the muscle between thumb and fingers, deep stimulation of muscles, nerves, and skin glands. Tapotement is light tapping or slapping movement applied with fingertips. It stimulates nerves, promotes muscle contraction, and increases blood circulation. Friction is circular movement applied with fingertips or palms with no gliding used, stimulates nerves and increases blood circulation. Vibration is a shaking movement. It's highly stimulating. Shampoos are designed for dry, oily, normal, color treated, and gray hair. Hair conditioners and rinses condition, soften, makes hair tangle free, restores normal pH, and removes soap residue. You do not want to brush hair prior to a chemical service if any cuts or abrasions are evident. Chemical services should not be recommended. If shampoo gets into client's eyes, rinse immediately, disinfect shampoo bowl and implements, discard contaminated and non-reusable materials, wipe up any water spill areas immediately. We're done? Yeah?
Nothing you can teach you. You're the teacher, it's up to you.
We know this, right? Always test the water temperature prior to use.
Mm-hmm.
Ensure water pressure is moderate. Decrease pressure during massage manipulation. If client expresses sensitivity, keep the back.
I've been sitting down too long.
You want to stand? Go ahead.
I'm not back. I got surgery. Jeez.
We know this. Wash and sanitize your hands. Okay. All of this I'm going to end up going through while we.
Okay, don't worry about it. Sorry, did not mean it, Your Honor.
No, you're fine. All right, so let's take a break, and then we'll get set up for our scalp
Okay.
treatment.
Okay.
Cool?
And I'm gonna see if it's. I'm
And
gonna
then we'll
look for
check
witches in my-
this when we come back too.
I'm gonna look and see if this popped up in you or something.
Yeah.
Cause I ain't eating nothing. I'm broke until I go home.
You didn't bring anything for lunch or anything?
I am super broke until I go home.
I got noodles for lunch. I got those.
Yeah, cause I don't get paid till later on. So, that's broke. I want a donut. I've been having craving for a donut all day. I have no idea why, but I've been having craving. Oh, this thing is on. I forgot you were on. Oh no, I forgot the crap. Okay, whatever. I forgot